So when you're entertaining the thought of having epilepsy surgery, someone mentions that to you, your first response shouldn't be of fear, it really should be of curiosity. And then some probing questions, in-depth questions about, well, what type are we talking about for me, my specific type of epilepsy as me, the patient, and then what does it look like? What is the journey going to be? And please outline that for me. That's a question that patients should ask the neurologist, the epileptologist, and the surgeon, the neurosurgeon, that they should see for an epilepsy consultation. But it's such a dramatic improvement in some patients' lives that it really is underutilized in the world of epilepsy care.
Every comprehensive epilepsy surgery are going to weigh all those issues very carefully when deciding on whether surgery is appropriate for the patient or not. The primary concern of a comprehensive epilepsy center is helping the patient get through the process of the pre-surgical decision-making, the surgery, and the post-surgical care. They have the highest priority, a great outcome at the very end for the patient. Risky, chancy surgeries at a comprehensive center will only be done if the situation calls for it due to the gravity of the patient's epilepsy condition. And the center can help patients and their family see the prospects for success and the prospects of not doing anything and the risks most clearly.
Timing for epilepsy surgery specifically. Should I do it now? Should I do it later? There's no urgency to do any of the particular types of procedures, but if seizures are worsening in general, considering doing it earlier is probably a better thing. The more seizures that we see with time, or especially highly frequent seizures, potentially over years, portend a bad outcome potentially for surgery. So if we know that you're not responding to medications and there are surgical options, the sooner you get to surgery, I think would improve the outcome for most patients. That's probably one of the only things, but it's only a minor part of what we consider prior.
I think patients that have had epilepsy for a long time realize that maybe they're misunderstood or that society may put stigmas on them. And when I encounter a patient with epilepsy, I like to remind them of things that multiple patients that I've taken care of have reminded me. And that is that this is a patient's opportunity to contribute to the diagnosis of epilepsy or the definition of epilepsy instead of letting epilepsy define the course of their life.
When a patient or a family member is thinking about their loved ones having surgery, I think that the first thing that they should consider is, one, whether a place or not has a multidisciplinary team in which surgeons, neurologists, epileptologists, anesthesiologists, neurocritical care, and all the health care team is involved in the care of that patient. That's what I always tell our patients when they can come to the Mayo Clinic. This is the place where they can truly have a multidisciplinary team taking care of them.